everyone. My name is Dr. Terry James. I am a specialist registrar, Kettering General Hospital, and today I'll be making a poster presentation on a research that was conducted in northern Nigeria. So the title is a post-Caesarean section surgical site infection. It is a comparative study of risk factors between patients who got infected and those who did not get the infection. So as a background, post-Caesarean surgical site infection, it's a common complication that follows Caesarean section. We all know that Caesarean section is a common surgical procedure that is globally done, and the incidence has been rising in recent time. Globally, the incidence of surgical site infection ranges between 2.6 to 9%. In sub-Saharan Africa and Nigeria, however, it ranges between 7 to 12.5%. Why did we conduct this study? So the rationale behind this study is that we know that the risk factors for surgical site infection is similar worldwide. But evidence has shown that there is a variation in terms of the relative contribution of these risk factors from one center to the other. As a result, we conducted this study in order to identify the relevant risk factors in our center so that we can be able to design an evidence-based protocol for its prevention. So the main objective of this study is to determine the prevalence of surgical site infection following Caesarean section and to identify the relevant risk factors in our center. Also, we also wanted to find out about the antimicrobial susceptibility of the relevant microorganism in our center. So what have we found? Sorry, I'm switching the device. Hello. Hello.
Hello. Yes, continue, please.
Can you hear me now? Hello.
Hello, continue, please.
Okay. So what have we found at this? So the methodology used for this study is that it was a prospective comparative study of all the women who had Caesarean section between October 2020 to February 2021 at the Federal Teaching Hospital Gombe in northern Nigeria. Overall, we followed 140 women who had Caesarean section for up to a period of 30 days in order to identify those who developed Caesarean section. So we used those who had surgical site infection as our cases and compare them against those who did not have surgical site infection. And then we look at those non-risk factors for Caesarean section to see which one is more relevant in our center. So we had a telephone follow-up. We called those women on the 10, 20, and the 30 days post-Caesarean section. And before discharge, we had given them an education on symptoms and signs of surgical site infection. And they were taught to call a phone number if they develop any of such. Those that had surgical site infection were called in for review of their wound, and then relevant management was instituted. We used the SPSS, that is Statistical Packet for Science version 20, for analysis of our data, and we use other statistical measures such as the odds ratio and the confidence interval of 95% using 0.5% as level of 0.05 as level of significance. So this were the indication for Caesarean section in our center: previous section, CPD, preeclampsia, obstructed labor, and others, which constitute at 2%. What did we find? We found that 5% of the patient who had cesarean section overall developed surgical site infection. And all these patients who had surgical site infection had emergency cesarean section. From the elective group, there was nobody who developed surgical site infection. And an interesting thing among the demographic is that majority of the patients who developed surgical site infection were primary gravida. So we thought this could be related to maybe due to inexperience in wound care, and so that could have accounted for a reason why some of them had increased risk of section compared to mothers who were multi-gravida. Second thing we found among the demographic is that 87% of patients who had surgical site infection did not have any formal education. So education had some role in preventing surgical site infection as well. So other risk factors that we found included prolonged rupture of membrane, prolonged operation time, and then obesity, hypertensive disorder, and anemia. But those who were statistically significant were prolonged operation time more than 60 minutes, which increased the odds of surgical site infection by 14.5 times. And then those who had prolonged rupture of membrane, they had about 10.2 times higher risk of developing surgical site infection compared to those who had prolonged rupture of membrane less than 24 hours. Other significant risk factors include surgery done by junior doctors, and this was other risk factors. So the next slide, as you can see, like I mentioned, we had 14 times more, those who had operation time more than 60 minutes were 14 times more likely to develop surgical site infection compared to those who had their operation time less than 60 minutes. And then for rupture of membrane, it was also 10.2 times higher compared to those who did not have that. So from the surgeon perspective, majority of the cesarean of the surgical site infection occurs in surgery that were performed by junior doctors, usually from the rank of senior house officers below. Whereas those surgery performed by senior doctors had less likelihood of developing surgical site infection. So we compared our findings with other studies across the world, and we found that our incidence of our prevalence of 5% was similar to about 5% that was 5% of a study that was done in Rwanda. And the methodology of these Rwandan studies seems to be similar to our study, which was also a prospective study. They followed patients up to 30 days, and they had similar telephone follow-up like we did. We also noticed that prolonged operation time was consistent, was found in other studies as a significant risk factor for surgical site infection. It increased in a study done in India. The risk for surgical site infection increased by threefold in patients who had prolonged operation time. In our case, it was about 14 times. Prolonged rupture of membrane has also been reported to increase surgical site infection risk, and this we also was consistent with the findings in our study. We also find that Staphylococcus aureus is the most common microorganism responsible for surgical site infection, and the commonest sensitivity was co-amoxiclav in majority of the cases. We concluded that surgical site infection following cesarean section is a concern because it occurs in about 5% of cases, and we also noted that it is commoner in emergency surgery performed by more junior doctors and in surgery that lasted more than 60 minutes. Also, we found that prolonged rupture of membrane significantly increased the risk of surgical site infection. And as recommendation, we recommended that there's need for more training, targeted training with emphasis in reducing the risk of surgical site infection to more junior doctors, and then taking an extra preventive measures in patients who had prolonged rupture of membrane, as well as those who have prolonged duration of surgery. Overall, we also noted that this study is not perfect as it has some limitation. And the limitation we identify in this study is the fact that we are unable to control the follow-up instructions that we give patients at home. So how they look after the wound at home, we are not likely to be able to have control over that. We also noticed that the sampling method was a convenient sampling technique, and as a result, it has its limitation as it may not give us a true representation of the sample population because randomization was not done in this case. And lastly, we noted that the sample size is 140 only, so that could be small. So there's need for further study with a larger sample size in order to properly elucidate further risk factors of surgical site infection in our center. Thank you very much for listening.
Thank you very much, Nuhu Teri James.